Focus.
All right, good afternoon. My name is Vince Gasillos. I'm currently a PTA student at Concorde Career Colleges. Today we'll be talking to you about bed mobility. I will first discuss immobility, lower back pain, and also I will be demonstrating to you how to do a correct log roll out of bed. The log roll will basically be for patients that have previous back injuries or spinal cord injuries. Also, people just with just that are having problems getting through, getting in and out of bed. Immobility is basically the ability to get in and out of bed or a chair. It affects a lot of geriatric patients, a lot of 65 and up. I think there's about 6 to 8% of geriatrics that are suffering with this problem of getting in and out of bed, that are living at home. Also, about 63% of geriatrics are struggling with it living in nursing homes. The immobility is a decreased muscle strength in the abdominal or back muscles, and also is involved with impaired balance and coordination. These can lead to bed sores, or also known as pressure ulcers. These patients are usually weak. They're either obese, like they're overweight, or they can have amputations. They lost a lower extremity or upper extremity, so it's going to be hard for them to get out of bed. Also, these patients will have paraplegic or quadriplegic, meaning that they have a paralysis. They won't be able to use a certain part of their body. Also, lower back pain can also be a cause of weak muscles, which in physical therapy we will be teaching you strength exercises in order to strengthen those muscles. Also, lower back pain can also be a cause of tight muscles, and in physical therapy we will be teaching you different ways to stretch out those muscles in order to be able to loosen them up, so you can carry on your daily activities with optimal strength and flexibility. Lower back pain can also be a cause of improper lifting, such as lifting with your back and not your legs. So when you're lifting an object, you want to make sure that you lift with your legs and not your back. You're not bending over with your back. Improper lifting can also be a cause of twisting while you are lifting an object. And most of these muscles that are involved are like your piriformis, your iliopsoas, a lot of lower extremity muscles, a lot of trunk muscles. Your iliopsoas has, your iliacus, your psoas major. There's also a pair of muscles along the spine, the paraspinal muscles. These will go along down your spinal cord, and these are also muscles that are involved with your lower back and can cause pain if you have like weak or tight muscles in those areas. Lower back pain can also be a cause of a pinched nerve, which is basically a bulged disc or a herniated disc, where the fluid in your disc, it cracks the annulus, which pinches the nerve, causing numbness, tingliness, along down the lower extremity of your body. This is also called sciatica, which is also known as just basically tingling and numbness going down from your buttocks, your back, down to your legs, down to your feet. Now I will be demonstrating the proper log roll. So if I can get a volunteer. And I'll have you just lay down on the mat. And right here, this is also known as your spine position, also known as a laying down position. So from right here, what you're going to do is you're going to bend at your knees, both knees, so where your feet are flat on the mat. And right here, you want to make sure that when you're actually getting out of bed, you're not twisting with one side and leaving the other extremity behind. You want to make sure that you roll with both sides to where the spinal cord is completely straight and aligned. That way you're not, messing up just with the twist. And this is all everything that's in the morning. So your lower back pain can also start in the morning as you're getting out of bed. So from here, I'm gonna have this arm right here and these legs right here. We're all just gonna roll all at once. And you're gonna grab onto that side of the bed. And from right here, you're gonna kick out your legs. And then you're gonna push yourself up with your arms. And that's how you go from supine to sitting. Thank you. Okay, I have discussed to you about immobility, lower back pain, also the demonstrated log roll. Is there any questions that the audience may have?
What are pressure ulcers?
Pressure ulcers it's a damaged tissue or skin that has been caused because of a reduction of blood circulation to that area. It's usually involved with patients that are laying in bed for too long or patients that are in wheelchairs for too long. And pressure ulcer can look anything like this. So as you can see, a pressure ulcer, immobility is a result of a pressure ulcer. So if we are able to get patients to gain more bed mobility and more strength in physical therapy and then having them learn how to use those muscles adequately and efficiently, then we will prevent patients from getting bed sores such as pressure ulcers.
What's the importance of the log roll?
The importance of the log roll, like I said, like when you're actually rolling out of bed, you want to make sure that your whole spine, your whole back, your lower extremities, your upper extremities are all aligned together so that when you roll, it prevents further injury to any patients that have spinal cord injuries, back injuries, weak back muscles. So the importance is to make sure that we're preventing future injury to those patients. All right, if there are no other questions, thank you for having me up here, and that's my presentation.